Welcome to yet another educational tip from your favorite nurse, Sister B. Fela. I hope you guys have been good. It's been quite a while. So today, ke tlo le shapa ka Scarlet Fever. It's a fever e leng hore e tletse hona yanong, more especially in kids amongst the ages of 5 to 15, especially kids by long hore ba kena crash because of now the infection easily transmitted from one kid to another because of preschools and the crèche and hygiene purposes that with the crèche. So because of this is more or less like not a respiratory infection, but it passes through respiratory droplets like through your coughing and stuff. So outgoing, let's get deeper into this. Is called Scarlet Fever. So Batadi, Scarlet fever is an infectious illness caused by group A streptococcus pyogenes. So it is the same bacteria that causes strep throat. So strep throat is what you commonly know as your tonsillitis. So the same bacteria that causes tonsillitis is the same bacteria that's going to cause scarlet fever. It spreads through respiratory droplets like through your coughing, or sometimes you told a lot more to you know, that's why I never mask because of we don't maintain the etiquette of coughing, and it is not something along more especially kids who are under the ages of 5 or in between 5 and 10, for them to maintain the etiquette of covering your mouth. So the streptococcal pyogens, they cause exotoxins which now cause this characterized rash and redness. That is how you differentiate scarlet fever. The signs and symptoms include this is not an allergic rash, this is not measles, but it is actually scarlet fever. Usually from 1 to 4 days after inhaling the droplet, the child now will start experiencing fever or what we call flu-like symptoms, which includes your fever, sore throat, and some bit of a runny nose. Now this fever and sore throat doesn't go away even after taking pharmaceutical measures and non-pharmaceutical measures like panado. But this fever now, when it comes back, the child is only getting hotter and hotter and hotter. Even low when they tap and sponge, still the fever does not go away. Now with the sore throat, it becomes worse in terms of what now the person experiences inability to actually swallow or chew because of now it affected the throat, meaning it can cause also strep throat, which is your tonsillitis. So that is symptom number 1, a fever and sore throat and runny nose that does not go away even after taking measures to make sure that this fever doesn't become intense, and also this sore throat or it's even after taking measures, it doesn't go away, it only gets worse in time. So within 12 to 48 hours after having this fever that does not go away, it's only getting stronger in time. The person or the child now will experience an onset of rash, maybe within the chest, spreads around the neck, sometimes it's around the neck, spreads around the chest, and then as time goes on, this rash is sent like it dry, it will send like paper, and then it spread around the extremities and also around the face. And now the difference going, this rash itchy, but not as itchy as your allergic rash, I understand. And then you will also see red or darker lines within the skin folds, which is on your armpits, more on your elbows. Sometimes it really happens on the neck, but more on the mouth. You get that because of the dryness of the skin and because of the rash that is there, red fine lines. That's how you identify the difference. Rash, allergic reaction, scarlet fever, measles. Yes, I wanted to say measles because scarlet fever, most of the time they confuse it measles. So it is not as itchy as your allergic reaction type of a rash, and it is not as intensive as your measles. It's not as intensive as your measles. It is dry sand like paper on texture, how it's rash. And also, what stands out about this condition is the strawberry tongue. There is white strawberry tongue and there is red strawberry tongue. white strawberry tongue occurs on the early stages of this condition, while as the red strawberry tongue occurs on the later stages of this condition. Now, this strawberry tongue causes irritability to the taste buds, so that's why you get Wana is unable to swallow, doesn't want food. How you know, even the lethargicness is because of but the inability and the irritation around the mouth, whereby most of the time the onset of Mtwenyana is usually confused with mouth ulcers. So the strawberry tongue, it is when on early stages it is white coated, and then the taste buds, the papillae, the papillae, and then the later stage of it, the tongue is completely red, not the normal red, but red and swollen, and then you can see those strawberry buds, whereby you can see on the demonstrated picture. And then also the child now a flushed face, whereby mona most of the time around the mouth, why I understand, whereby as a no it is accompanied by the other symptoms, and then also there's tender cervical limbs on the groin most of the time, whereby the tender sometimes even more on the neck in intensive cases. Treatment for this condition, unfortunately, this condition only responds to antibiotics. So I am saying unfortunately because of there is no non-pharmaceutical measures that I can give you guys, or mix up tea le vinegar. I remix it this time. Tlisa ngwana or tlisa motho o clinic. This condition, this rash only responds to antibiotic. This rash, fever and tiredness, inability to swallow and everything, it only responds to antibiotic. So the medication that you are having at home and non-pharmaceutical measures that you are having at home will only perpetuate this, but it won't take it away. It will just keep on getting back stronger with time. It's only undertaker. The child has this condition. How do you prevent the spread of the condition? Because it's streptococcal related, the infection or bacteria can change from child to adult. So because of its streptococcus, as the tonsils. So we are trying to prevent the spread from child to adult or from adult to child. So number one, early treatment, meaning consultation and following instructions or by the doctor to take your medication. Finish the course of the antibiotic. Good hygiene practices, especially hand hygiene, washing of your hands on a regular basis, and then avoid sharing home utensils and also utensils crash, your spoons, your cup, your plates and stuff. For the person who are specified things for themselves so that it doesn't spread around the house or from one child to another. For very safety measures can also include a mask, which is something that we have which is an etiquette that we have let go of. I don't know for what, but because of freedom is power. But how to worry, you have a child or somebody coming to one streptococcus infection, to prevent the spread, number one, mask. And also because maybe make measures, because now it will come from one child to another and then also cause what, reinfection, meaning and will also experience complications like your rheumatic fever, post streptococcal glumo. Yeah, you're not post streptococcal pneumonephritis. You are not able. So, which is one of the complications. Also, I think otitis media. But early treatment prevents those complications. So Bayana, I hope this health tip was very informational, and you will follow the steps by what? How bona fela just send like a red fine sand paper like rash. zama consultisa ngwana or le na is motho o mogolo tsamaya o ile consult. Till we meet next time, take good care of yourselves. Khanya ke yena.